Hi, my name is Kevin Hay, and I will be performing a HEAT exam along with my partner here. Go ahead and introduce yourself.
Caitlin Andrade.
I'm gonna go ahead and start here with some hand hygiene. We're gonna go ahead and start by assessing the head and neck area. I'm gonna start by examining the hair. Uh, No issues with the hair. Quality, distribution, and texture is normal. No apparent evidence of hair loss. I'm gonna go ahead and examine the scalp now. I don't see any scaliness or lumps or lesions. No signs of infestation. Gonna examine the skull now. Size appears normal to head, to body. I'm sorry. No lesions, no masses, also no depressions that I can see. Uh, as we can see, the skin appears normal, is pink and flushed. Gonna go ahead and palpate the cervical lymph nodes, starting with the preauricular lymph nodes, the postauricular lymph nodes, the submandibular lymph nodes, um, the submental lymph nodes right here, the parotid lymph nodes. I'm going to move into the superficial cervical membranes or lymph nodes, the submental lymph nodes, and the superficial cervical lymph nodes, as well as the subclavicular lymph nodes. No apparent lesions or masses, no tenderness noted, no immobility. Lymph nodes appear normal. Gonna go ahead and examine the trachea here as well as the thyroid. If you can go ahead and lift your head up for me. Trachea is midline, no abnormal masses on the thyroid, size and shape is consistent. Go ahead, we're going to test cranial nerve number 11. Go ahead and look up and down for me, please, and side to side. Go ahead and lift your shoulders against my hands. Okay, cranial nerve number 11 is intact. Now we're going to go ahead and test the eyes. The first cranial nerve I'd like to test is cranial nerve 2 with my Snellen eye chart. Gonna go ahead and ask my patient to cover one eye and read right here for me.
L T F P H.
Go ahead and do that with the other eye.
L F.
Go ahead and read this one for me.
C P D H J.
Okay, now go ahead and read this line for me with both eyes.
It's L T F P H.
Okay. So, right eye was 20/20 vision and left eye 20/25 vision. I'm gonna go ahead and test the cardinal fields of gaze. Go ahead and look at my pen light right here as I go from left to right. Just use your eyes, okay? Okay, I'm also gonna go ahead and test the accommodation, okay? Okay, both eyes accommodate normally, normal cardinal fields of gaze. Let's see, gonna go ahead and take a look at the sclera and the conjunctiva as well as the iris and the pupil. Sclera is white on both sides. Gonna check the conjunctiva now. Conjunctiva is pink and red on bilaterally. Go ahead and look forward at the wall for me. We're gonna check your pupils now. Pupils measure up about a 3+ on both sides bilaterally, and both pupils are round and reactive and accommodate to light. No ptosis of the eyes, no facial drooping noted. Facial symmetry is intact. We're gonna go ahead and test the retinal vision. I'm gonna go ahead and dim the light a little bit here so that I can use my ophthalmoscope. Retinal vessels appear normal as well as the retinal discs. No issues with the retinals at all. Let's see. Let's go ahead and move on to the ears. I'm going to inspect both ears bilaterally. No pink or redness noted. Ears are pink. No redness noted. Does this cause you any pain at all?
No.
No pain reported by the patient. Gonna go ahead and palpate the tragus here. No issues reported. Gonna go ahead and check with the ophthalmoscope on this side. The otoscope, I'm sorry. Cone of light is at 5. Pearly white membrane on both side on the right side. No redness noted. Just cerumen noted in the right ear. However, no lesions or any masses or any polyps noted within the ear canal. Gonna go ahead and check the left side now. As well, I'm gonna ask her if she's having any pain here on the left ear. Do you have any pain here?
No.
No redness noted on the ear. Just some cerumen noted. Let me go ahead and check the membranes here using the otoscope. Membrane is pearly gray here as well. No redness or lesions or polyps noted. I'm gonna go ahead and assess for cranial nerve 8 using the whisper test. If I can have you occlude this first ear, go ahead and cover your ear and tell me what you hear.
Pizza.
Okay, go ahead and do the same to the other side.
Marshmallows.
Okay, no issues with the cranial nerve 8. Patient is able to hear. Let's see. I'm gonna palpate the mastoid process here in the back. You have any pain here?
No.
No swelling or pain or redness or any signs of lumps in the back on the mastoid process. Gonna check on this side here as well. Do you have any pain here when I palpate?
No.
No pain or redness noted on that side as well. Let's see. When I assess the ear here, it's important that I lift up and back, but still no signs of redness or pain. Gonna go ahead and continue my assessment with the nose here. Go ahead and include one nose for me and take a deep breath in and out of your nose. Same thing on the other side. Okay, no issues. Both nostrils are patent. Nasal symmetry is normal. Gonna go ahead and change the use the otoscope to look into the nose. Okay, the nasal cavity is symmetrical and patent, no redness. Both nostrils are patent bilaterally. Gonna go ahead and perform the cranial nerve test for cranial nerve number 2. If I can have you close your eyes and tell me what this smells like.
Like a men's cologne.
Yes, you are correct. Cranial nerve number 2 was intact. No drainage was noted. Smell test was performed correctly, and patient has cranial nerve 1, is intact. Now I'm gonna go ahead and move on to, I'm actually gonna palpate the sinuses, palpating the frontal sinuses. Do you have any pain or pressure here?
No.
How about here on the maximal sinuses?
No.
No? Okay, so we're gonna go ahead and move on to the mouth and pharynx. Gonna go ahead and inspect the lips. Lips are pink, moisturized, no lumps or ulcers or cracking or scaling. I'm gonna go ahead and use my pen light and check the oral mucosa. Go ahead and open up your mouth for me. Let's see. The top palate appears normal. Nope, is pink. No cavities, no missing teeth. Tongue is pink in color, no thrush. Go ahead and lift your tongue up for me. No lesions at the bottom of the tongue noted. Teeth are normal and intact. Let's see. Gums are normal, no swelling or ulcers. Gonna go ahead and check the patient's cranial nerve number 9 and 10 using a tongue depressor. Go ahead and stick out your tongue for me, please, and say "ah." Say "ah," please. Uvula is midline, no deviation. Patient has normal gag reflex. Cranial nerve number 9 and 10 are intact. Go ahead and stick out your tongue for me and move it side to side. Cranial nerve number 12 is intact. Gonna continue on by assessing the tongue. Let me see. No discoloration or masses. Texture is normal of the tongue. No thickening of the tongue either. Soft palate is normal. Uvula is midline. No tonsillar enlargement. Let's see. That's going to conclude my assessment of the head, ears, eyes, nose, and throat. Going to continue on with my suicide risk assessment here. Going to ask you questions from 0 to 3. Have you had any little interest or pleasure in doing things?
No.
Okay, so 0.
0.
Feeling down, depressed, or hopeless.
0.
Trouble falling or staying asleep or sleeping too much.
0.
Feeling tired or having little energy.
0.
Poor appetite or overeating.
0.
Feeling bad about yourself or that you are a failure or have let your family down.
0.
Trouble concentrating on things such as reading the newspaper or watching television.
0.
Moving or speaking slowly so that other people could have noticed.
0.
Thoughts that you would be better off dead or hurting yourself in some way.
0.
Patient has a low score on the suicide risk assessment. Have you ever had any history of depression in your life?
No.
Any history of anxiety?
No.
Any racing thoughts or mood changes?
No.
Any feelings of wanting to be dead?
No.
Any thoughts of wanting to hurt anybody else?
No.
Any loss of appetite in most recent days?
No.
Any weight changes? Any unintentional weight loss?
No.
No. Any history or family history of psychiatric or mental health issues?
No.
No. Okay. Patient is scores a low risk on the suicide screening. This concludes my assessment for the heat exam as well as the mental health exam. If you have any questions, please feel free to comment. Thank you very much for listening and watching. My name is Kevin Hay.